I believe that most primary care is really about behavior change. And many of the barriers to behavior change are psychological and relate back to either functional or other barriers that people bring into the work that they're doing. So there are psychological barriers. There may be social issues that are at play. By being able to bring a behavioral health provider into the room, you had an opportunity to tackle some of those things at their root. And I think that for me was what was most exciting.
Welcome to Season 2 of Neural Compass, where we explore the future of mental and behavioral health at the intersection of clinical care and cutting-edge AI. I am your host, Mark Jacobstein, the co-founder and president of Jimini Health. I am really excited this week to be sitting down with Dr. Harry Ritter. The doctor's important. We're going to get into what it means to be an MD leading a company as he is. But Harry is the founder and CEO of Alma, which is a nationwide network and software platform that brings tens of thousands of independent therapists together, allows them to accept insurance, and helps them to run modern clinical practices and find their patients. So we're going to talk a lot about Alma, but it's been a really interesting path. So before running Alma, Harry led care delivery at Oscar Health. He was a consultant at McKinsey. He is both a JD and an MBA. I want to talk about that. And really interesting winding path to bringing Alma to market. So maybe we'll start there, Harry. First of all, really appreciate you being here today. Tell me about the journey. I don't meet a lot of MD-JDs, and I'm sort of curious, MD-JDs who have a virtual MBA at this point running a business. So tell me a little bit about the journey.
Well, first of all, Mark, thank you very much for having me on this. Big admirer of the work that you do. And I think it's wonderful you're creating a space like this to talk about these important topics in our industry. So thank you for that as well. It's a big investment of energy to do that, but it's an important part of what we do as an industry, talk about where things are going and how we're working collaboratively to realize that future vision. So thank you. You're right. It's a little bit of a winding path. I started out in medicine. I come from a family of doctors. Growing up, there was always a strong sense that a life committed to service through healthcare was meaningful and something that we saw as a value in our family. I also come from a family of lawyers, and I was an only child. And so as a good Jewish only child, my parents needed both a doctor and a lawyer, and so I had to do both. But
that's funny because my stock joke is that between my wife and I, we have an MD and a PhD, and the problem is she has both. So you went the other route.
Yeah, there you go. Exactly. Well, it's interesting. I mean, one of the there's this great quote I love. I don't quote often, but Thoreau has this quote, and I'm paraphrasing. He basically, this is back, when ships traveled via sail, but he said the course of the best ship is attack of many turns, but when viewed from a sufficient distance makes a straight line. And I think that's true of life. You tend to take a meandering course, and only as you zoom out does the narrative arc appear. So I can't pretend that each step in my career has been so pre-planned and methodical as it might seem in retrospect. But the reality is I really, for me, it was a very powerful experience to come out of a clinical education in medicine and then have the opportunity to think about healthcare from the regulatory and legal angle. The reality of American healthcare in particular, but healthcare, I think more broadly globally, is that it is for many important reasons a highly regulated space that we take very seriously when it comes to things like privacy, security, regulation. And a lot of that framework ultimately has significant far-reaching implications on how care is delivered, reimbursed, managed in our societies. And so it was really a phenomenal experience for me. I finished up my medical training, and then I was getting my law degree at NYU while working at Oscar Health during the early days of the ACA and the exchange market, and seeing really a fundamentally new reimbursement model come to market.
And Oscar had sort of been born out of the ACA, as I recall. This was, and I think you said something I think very important in there about the regulatory framework, but also, I mean, healthcare delivery is a systems problem. It's also a medical problem, and the medical training is incredibly important, but it's a system. People have to be able to get paid, and people have to be able to find their care, and people have to be able to have their privacy protected, and they have to be able to move from generalists to specialists, and all of this. And so this must have been a fascinating time early in Oscar's history. If you don't mind walking us through some of that.
It was a really great experience. The founding team at Oscar are among some of, I think, the most innovative thinkers in healthcare, and also some of the bravest thinkers in healthcare. I think Josh and Mario and Kevin, when they started the business, really saw an opportunity to use this new regulatory framework to launch one of the first new insurance companies in decades, and to really do that with a commitment to using technology and customer centricity and simple experiences to create better consumer experiences and better consumer choice. And I think that was a really brave and exciting thing for them to have done. It was really a privilege to get to see and be part of from the early days. And it was really about how do you take this new regulatory framework around exchanges as a model, and how do you create unique, really customer-focused experiences to help people access, find care, purchase care, and then use that care. And it really did help shape a lot of my early thinking about the role of the customer and the role of data, the role of technology, and creating some of the connectivity that we desperately need in the system today.
Yeah. So pulling that through then, I mean, the next step really was to build Alma. And I'm curious, I mean, from your perspective at Oscar, of course, you get to see the entire healthcare ecosystem, which mental and behavioral health constitutes, frankly, a reasonably small part. It's a huge business, but it is a small part relative to, I don't know, oncology or cardiac care, et cetera. And so I'm curious about what you saw with mental and behavioral health that made you think this is the place I want to go have my life's work and make the impact that I can.
It was really the confluence of two narratives coming together, as I think is often the case for founders. One a personal and the second a professional. On the personal side, at that time, I was a solo caregiver for my father, who has since passed away, going through the final years of his life. He lived in California. I was living in New York. I was going back and forth. And I was managing the anxiety and anticipatory grief that come with managing the health of a loved one as they go through that final period in life. And my now wife encouraged me to go to therapy. I was a quintessential primary care doc who generally treated mental health as that sort of forgotten part of healthcare that you sort of tiptoed around. Found my way to a provider.
Not a lot of evidence. It's interesting that
stigmatized, right? I mean, it was there was I think historically a real sense that you didn't want to be associated with the need for mental health services. So there was a lot of stigma too.
I think fortunately we're seeing that change fairly dramatically over the last decade, but even still, I think there's a fair amount.
Absolutely.
Thank you for sharing that, by the way. It's interesting. Of the guests I've had on the podcast at this point, probably 25 of them, I'm not sure that I've spoken to a single one, maybe one or two, who didn't have their own sort of personal mental health story as part of informing why they got into the business in one way, shape, or form. And what I think is interesting is not so much that this is particularly self-selective. Actually, my thesis on this is that there are no humans who don't have their own mental health journey. Like, we evolved to survive. It was evolution, not intelligent design. And there are certain things about the world that we live in that are intrinsically anxiety inducing. We don't have anything that prepared us for the dopamine machine in our pocket or for the sort of the overwhelming nature of modern life. And so everybody has a mental health journey. And one of the great things about working in this field is that you have your own lens to apply to the problems we are taking on. And frankly, everyone you work with will too. I mean, I don't think we've ever hired an employee who for whom this wasn't an important mission and where it wasn't personal.
What's one of my favorite parts of running a business in this space? I think you're exactly right. Every single human has some connection to this, whether it's personal or by one degree of distance. And so it allows you to build businesses where the mission is just so fundamental to the employee experience and to what incentivizes and motivates us. I totally agree with you. And for me, it was interesting. So going back to that, origin story, I had that personal experience on the one end, and then I was at Oscar, where I had the privilege of being part of building some of their, early network as they shifted from their original network to sort of a directly contracted network. And I believe very strongly, and I continue to believe, that the payer-provider relationship is a critical one for success in healthcare. I saw more and more blurring of the line between the traditional provider and the traditional payer role, and a shift to a much more collaborative and integrated model. And so I pitched the leadership at Oscar to start our own care delivery business. So we launched the Oscar clinics, which were our first ever in Brooklyn, a integrated primary care and behavioral health 4-wall model, where the primary care doctor and the behavioral health provider sat side by side caring for a population. And it was really there where I saw the experience I had, to your comment a minute ago about how folks who come into our businesses all have some direct degree of connection to this. I saw that, I wasn't alone. Folks were really looking for access, but providers didn't take insurance, and providers were operating on really archaic systems of care. And so that was really
it's sort of shocking. Medicine, my general take on, and there is no industry on earth, I think, where the disconnect between the level of sort of sophistication, intelligence, and education of the people who are in the field and the sclerotic nature of the rollout of technology is more dramatic than healthcare in general. And I think it may be even most pronounced in mental and behavioral health, which, of course, from a business perspective is a great opportunity. But it's also sort of a tragedy that it always shocked me that it took something like the ACA and $40,000 or $50,000 to get people to actually make medical records electronic. That's incredible that the stuff was still being written on paper, and actually sort of still is, and that the NHS is still the largest purchaser of fax machines on earth, and all these other sort of crazy things about our industry. I love the entrepreneurship there. I'm curious what you learned by having sort of primary care folks in the same room, actually or virtually, as the people who were providing the mental health care. What were the benefits for some of the patients in the Oscar system?
I believe that most primary care is really about behavior change, and many of the barriers to behavior change are psychological and relate back to either functional or other barriers that people begin to the work that they're doing. So if you ask someone with diabetes who is overweight and not adherent to their medication, whether they know on paper what the right thing to do is, of course they know. It's not complicated, right? Everybody knows it's not like another PDF handout is what's going to make the difference between them getting their hemoglobin A1C under control or not. There's behavior change. There are psychological barriers. There may be social issues that are at play that are preventing that. And so by being able to bring a behavioral health provider into the room, you had an opportunity to tackle some of those things at their root. And I think that for me was what was most exciting. Was not only the impact you could have on behavioral health, which, as you commented a minute ago on, is actually a relatively small percentage of the healthcare pie, but really how by fixing or addressing some of those behavioral issues, you could actually have a far-reaching impact.
When we've had this conversation with payers, they get this too. I mean, I always describe undertreated and untreated mental health issues are like the great comorbidity. In addition to being themselves like the sand in the gears for having a happy life, and in the case of serious mental illness can be actually life-threatening, they also make everything else worse, right? To your point, somebody who is depressed and diabetic is not just sicker than someone who's just diabetic, they're more expensive for the system. And so what's interesting is I've never had a conversation with a payer where they've sort of pushed back on that idea. There are other challenges to sort of data and efficacy and how do we actually stitch this all together, which I think is a lot of what you've been trying to address at Alma, and we can get into that. But I think there's, at least my perspective on this is there's a pretty solid understanding of the interplay between those. It's just been very difficult, despite sort of that understanding, until folks like you came along, there weren't systems in place to actually account for this. And I also have my senses, I don't know if this is your experience at Oscar, there's a lot of stress for the PCPs because they know this too. They want you to get the help for your anxiety or for your depression, or you're stuck on with a behavior that is like you're overeating and it's causing challenges for your diabetes, et cetera. But they haven't historically had a place to go. I mean, there's this there was an impedance mismatch with I don't even have good therapists to send people to. They're too busy. I don't know how to get it scheduled, et cetera.
Well, I think two comments. One, I think you're absolutely right. I think historically primary care doctors are overworked and spread way too thin, and they don't have the ability to really do that kind of work to help folks find. That was our challenge in the clinic. I remember we hired a full-time intern whose job was just to go through the provider directory for Oscar's behavioral health network and try to find clinicians who in fact were accepting patients so that we could give our patients a curated list of available clinicians in the behavioral health network that took insurance. So that just worked primary care doctors are not compensated for and do not have the capacity or skills.
By the way, that's probably a great heuristic for when you should start a business. Like when you've hired an intern to do something that seems crazy because it is such an urgent problem and yet nothing exists. That's probably like this is a Paul Graham thing. Do things that don't scale. We're going to start like hire the intern. Maybe we should build a piece of software to do this.
But this is where I think the system and the regulatory and sort of business model challenges really start to emerge, because you're absolutely right. No payer, provider, academic I've ever spoken to suggests that treating behavioral health comorbidities will not have a significant impact on everything else. Everybody acknowledges that. It's right. Well validated in the literature. The challenge is, how do you do the math actuarially to bring that into your pricing if you're a plan? How do you think about time horizons, right? What benefit is going to accrue based upon your spend in this quarter for outcomes in this quarter, this year? Or is it going to accrue for 5 or 10 years from now? Will they still be my customer or somebody else's customer? So you start to get into a bunch of these really interesting systems issues that I think are ultimately where things break down. So no one will ever tell you we shouldn't have more access, we should improve quality. Treating behavioral health won't ultimately improve outcomes more broadly. But we operate in a very broken system where individual stakeholders are not necessarily either incentivized or set up with the capabilities they need to actually realize what we all know to be.
It's interesting because I always thought it was entirely an incentives problem. But the longer I've been in the industry, the more I think it's actually the systems issues are at least as important as the incentive problems. And again, this maybe goes back to why Alma. So maybe I'll use that as a jumping off point. Tell us, for our listeners, what you're building at Alma and why. Sort of what's the North Star and what have you been able to accomplish so far?
The idea behind Alma was really to create a platform for behavioral health clinicians to become active and engaged and supported members of the provider community in delivering behavioral services that would be ultimately reimbursed through insurance and available as part of the system. And so, what we really set out to do was build a new model for organizing providers where, rather than sort of the traditional group practice model where you go out and you hire or acquire practices to build a larger behavioral health organization that can achieve economies of scale and invest in R&D and technology to support that large organization, we would instead really think of ourselves as working for the clinicians, where we were trying to build services that could allow them to continue to operate an independent practice, but with the support, technology, resources of a really well-established platform behind them and a community of clinicians who could support them in the work that they do. And so we've been very fortunate, over the last few years. We, now support, well over 20,000 providers in all 50 states, delivering millions of visits each year. And
that's probably on the order of 10% of the entire ecosystem at this point ish.
Well, I don't know exactly what the stat would be there, but we're incredibly proud of that impact, because I think there is really you asked the North Star, right? The North Star of this work that we all do is really about how do you get people access to care that works and that they can access, that is really available to them. And I think for us, every time that we see that a provider is able to build a practice where they're really helping people and those people are able to afford that care and improve through that care, that's really what gets us up in the morning.
I heard one of the really interesting comments. I was listening to one of your other podcasts, and you were talking about the fact that insurance in the U.S. is largely set up to deal with large healthcare delivery organizations. It's very hard if you're United or Cigna or Aetna, to have an individual relationship with every single shingle provider out there. And part of what's happened actually is in a lot of other specialties, folks have been rolled up, right? So the community oncologists, in the old days, there were 1 or 2 person practices. More and more what's happened is sort of PE came in, and because of exactly this dynamic, like insurance wanted to work with larger groups, they rolled up organizations, they built more infrastructure. Now, instead of being 3 oncologists, you're 100 oncologists. Now you're actually large enough to have a conversation with Aetna and with Cigna, and you have somebody on staff whose job is to do that, and it actually works. that is, to your point earlier, that is not at all the dynamic for therapists. Actually, I'm 90% sure my sister, who's an LCSW, is an Alma customer, right? So she's classic. She is a single shingle provider. She has a physical office, near the University of Chicago that she shares with one other therapist, and she runs a business. She's not really a businesswoman, but she runs a business, and I think for the providers, my suspicion is that a lot of this is about, I don't know if you call it it's provider in a box, like it's a business in a box for them. And I'm curious, sort of what were the first pull throughs to actually, 20,000 providers is an amazing accomplishment. What are the things that really started to get that flywheel spinning for people? What were the most valuable pieces for the therapists?
Well, you made the comment a minute ago, providers, and this is true not just of mental health clinicians, but really healthcare providers in general, are trained for years and years to practice a craft, not to run a business.
Right.
And so most physicians, nurse practitioners, psychologists, clinical social workers, et cetera, will go through the entirety of their training and never have any sort of support in terms of learning how to run a business. And the reality is, in our system, we are all running businesses, right? Businesses that are deeply mission driven, that are ultimately aligned against helping people, but at the same time businesses. And so, there's a lot of work that goes into creating a business. You have to invest in your technology. You have to find ways of getting customers. You have to make sure that you're able to bill, get credentialed, submit claims, manage appeals, right? There's just a whole universe of work that goes into that. Our thesis was that the best clinicians ultimately really treasured ultimately that ownership and being their own business owners, but they desperately needed help to do that and to do that effectively. And my view is, if you think about the arc of business models in not just healthcare, but more broadly, historically, the idea was small business owners, right? People would start small businesses across any industry. You had a period of consolidation, large vertically integrated businesses that developed to achieve economies of scale and deploy technology through these larger organizations. In the modern era, we have this amazing gift of technology that can fundamentally reshape the way that organizations can be created, where you can have a much flatter, more dynamic, where ownership and decision-making can be really distributed more democratically to ultimately the people who are at the front lines doing the work. But we can use technology, we can use investments in things like what you all do to help clinicians at a scale that you could never accomplish in a traditional small business model. And so that's really what we tried to do for clinicians, is say, look, we want to help you continue to have that independence and that ownership of your practice, but we want to make sure you're doing that with the best of what's out there in terms of technology and resources and support.
Yeah, and it sort of allows you to have the best of both worlds. And the technology and the support piece, of course, is particularly critically important, because the way you get paid in U.S. healthcare largely is with relationships with large insurance companies, which is not something that your average single LCSW does not want to be negotiating or having conversations with all of the with all of the insurers who operate in their particular state. That's just not something that is, my sister didn't go to Smith College of Social Work to learn how to do that. And it's not a great use of her time, et cetera. So, I think this is one of the really important pieces. So speaking of technology innovation, maybe we'll switch gears here a little bit. A lot of what you built includes everything from patient matching, handling of claims and insurance, building of back end record keeping, et cetera. A lot of back office function and patient matching. Hopefully, we're very excited, obviously, at Jimini, as you know, about sort of the future of patient care, et cetera. So I'm curious, you saw some of this at Oscar, did your time at McKinsey, and I'm sure are very aware of sort of the rise of AI here. What do you think the future of mental and behavioral health care looks like? What's different 5 years from now than what we have today?
Well, I think to first answer that question, you also have to take a look at just how different behavioral health is from what it was 5 years ago.
Yeah.
Right. Because the arc of change is not sort of kicking off now. One of the things you said earlier, behavioral health historically in the pre-COVID era was among the most tech-phobic sectors of healthcare.
Yeah.
The vast majority of clinicians were in person. They were documenting on paper and pencil. there was very limited EHR adoption in the behavioral space.
There's almost no measurement. Like if you got a PHQ-9 or you got 7 score, I mean, once a decade, that was a lot,
And to the extent that you did, it was filed away in a filing cabinet under your desk, right? It wasn't a part of your integrated record. COVID, really changed that. People often say to me, what do you think is the lasting implications of COVID? I think the mental health demand was very much there before. I think it did a lot to destigmatize because we all experienced this sort of collective trauma that we could talk about. And that brought, I think, mental health out of the shadows. But that was also happening before. If you think back to, the Michael Phelps advertisements and all of that, right? That was already starting to happen. It destigmatized, but what it really did was it drove technology adoption in healthcare because these providers had no other choice but to start to see patients via teletherapy and then discovered that it was actually quite effective and allowed them flexibility in ways that they had not experienced before. And so all of a sudden, mental health became the most technologically forward. In fact, if you look at telemedicine utilization and behavioral health compared to other industries, most have reverted back to fairly similar levels of telemedicine adoption as were happening before the pandemic, or at least they've gone back to a sort of similar growth curve, right? That spike has gone down. Behavioral health, that's not true. Behavioral health remains a virtual dominant modality.
Well, I mean, it's one of these things where the goal with therapy largely is, right, to cure people with words is the greatest description I ever heard. But it's not 100% the same having a Zoom session, but it is pretty darn close. And it is very different than, there are other kinds of medicine where I need to take a scan or I literally need to touch you or feel you or, tap your knee. And so it does feel like of all the branches of medicine, the one where telehealth should have been. And of course, there were regulatory, it's interesting because I'm sure there was pushback from therapists before the pandemic. Of course, there were also regulatory challenges, but I do think this is one of these things like never let a good crisis go to waste. One of the great things that did come out of the pandemic was, I think, a shift in the way people thought about what could be accomplished the way we are having this podcast conversation. And that's true for a lot of traveling salespeople now have to get on the airplane a lot less and can spend a lot more time with their families, which is wonderful. But I think the impact in healthcare has been even greater.
You're absolutely right. I think that when we talk to our provider community, there are unequivocally many patients and many situations where in-person care is absolutely essential. And, we're very proud of the fact that many of our clinicians are continuing to deliver a significant volume of care in person. And we continue to believe that there's an important role for that. And it's true in relationship building in general. There's a reason we get on planes and we meet with people in person. But there are unique advantages to virtual care. It significantly reduces no-show rates. It allows people to show up for sessions during work when they wouldn't have been able to otherwise because the transit time there and back would have been prohibitive. So it has a lot of benefits too. And I think from a technology perspective, to your question about the role of AI and how we're thinking about the role of technology going forward, it's now given us a fundamentally different landscape into which technology can thrive because clinicians are now operating in a very digitally native environment. They're seeing most of their patients in a virtual environment. And so technology is now the default part of the care experience. I think AI is a really, everyone's talking about AI. It's the theme of the year, right? I think, or at least the last few years. We're really excited to understand the role of AI in the future of behavioral healthcare. I think there has to be acknowledgement of two fundamental truths about the role of AI. The first is that it is something that patients want. Mm-hmm. If you look at how people use ChatGPT.
I was gonna ask you about that. I mean, this is Sam's biggest crisis right now. Is everybody wants to use ChatGPT as their therapist, and of course, OpenAI does not want that for obvious reasons. But whether they want it or not, it's happening.
Well, and it's clear that there is a there, but it needs to be thought of very carefully because you see stories on far too often a frequency about these things going quite poorly and real issues and challenges emerging. So on the one end, there's something about the role that AI can play in the mental health landscape that consumers want, clients want, and excites them and creates something meaningful in terms of their journey. On the other end of the spectrum, you have real concerns that need to be addressed around the role of safety and efficacy, and also the role that the clinician needs to continue to play. Our view at Alma is that invariably AI is something that we need to be excited about and embracing, but we need to do it thoughtfully. We need to do it where we're really centering on the clinician and ensuring that ultimately the clinician is in the driver's seat and using these tools in ways that are appropriate for their patients, because that's ultimately the relationship that we're trying to augment, never replace. And I think that that's where, there's a lot of discussion in the market. I think people can be absolutists in one direction or another. It's, the
Well,
solve for anything, or it's the
yes, there's the Vinod Khoslas of the world who think we've, for 15 years, have been saying we're not going to need any more doctors. And I continue to not believe that's true. And even in the fields like radiology, where they've been saying, oh, really, we're really not going to need the doctors. And we continue to, I think the AI has allowed people to up level, right? It has allowed them to operate at the top of their licensure and do the most important work that they were trained to do, instead of maybe being in the weeds or working at the fact that we now have AI scribes, I think makes everybody happy.
There's so much work that providers across the spectrum do that is just a waste of time, drives burnout, drives dissatisfaction, prohibits providers from taking the step back and thinking critically about what they're really uniquely best situated to do, building that human relationship, the trust, the therapeutic alliance, the treatment planning. That's really where, I think clinicians will continue to have so much work to do. And so our thesis at Alma has been, wherever we can help providers eliminate administrative work through AI, we are excited about that. That is a absolute win.
It's just an easy win. Right? Nobody's pushing back on that. Yeah.
And where we really want to engage with our community thoughtfully and in partnership is, how do we ensure that we are bringing experiences to market that help them build successful practices, deliver high quality care, serve the customer's needs in ways that are safe, thoughtful, clinically efficacious, and ultimately, help us achieve the long-term goals around quality and cost.
Yeah. And I mean, for us, part of this is also, I don't care how good a therapist you are, you can't be there for all your patients 168 hours a week. And so that's another piece, is that essentially the extension of care. And I think the co-pilot model, as it were, is one that we're seeing. And I mean, of course, it started with coding for a lot of obvious reasons. We had a great corpus of data to train on with things like GitHub, but also we had, and there's lots of money there. But the sort of co-pilot model of having an AI that helps the human operate, again, at the top of their licensure, I think is something we're going to see, not just in mental health, but lots of other places. My other perspective on sort of what's happening with ChatGPT, and for that matter, Claude, et cetera, as therapists, is what it speaks to is latent demand. When somebody is going to ChatGPT or to Claude to have a conversation about the fact that they're depressed, I mean, I'm glad that, frankly, all of the large AI organizations are thinking about a sort of crisis intervention and also sort of an onboarding plan to get those people to a therapist. But it also just speaks to, we as an industry have to do more. And I think the efficiency with the marketplace so that people can find the right therapist really quickly is incredibly important, and just the ability to provide more care. Because I think, as we started the conversation with, my perspective on this is almost everybody would benefit from some therapy, right? This is like, it's part of having an anxious mind is part of the human condition. The world we live in, I think, contributes to that. But also there are techniques. I mean, learning some cognitive reframing is useful for everybody, even if you're a happy, well-adjusted person, in the same way that every kid learns how to read and write and the arithmetic. I think we're learning that it's probably useful for everyone to have a little bit of a mindfulness practice, and it's useful to understand, have a gratitude practice, and it's useful to understand cognitive reframing, and those things they're all good. And that it doesn't mean that necessarily everybody has a reimbursable issue that requires them to be sort of inside the healthcare ecosystem at any given time. But I do think that there are certainly still more people who need help than we've been able to provide help for. And I do think that the systems that you're building at Alma, and I think it's a systems problem, I guess, is maybe the way I think about it.
I really like that framing. I think it's, it's interesting. Why does healthcare exist? Does it exist to reduce symptoms of disease, or does it exist to help us optimize the lives we live, to drive value in society and community? I would like to think that as an industry, we can aspire to the latter, and it's not simply about the former, but our medical model is very much predicated on the former. You have cancer, we try to cure it. You have the flu, we try to cure it. You have a broken bone, we try to fix it. And we we historically as a system have struggled with preventive health, with health optimization, right? How do you make sure that people are doing the things now that will prevent the stroke, the heart disease, the cancer down the road? And I don't think that there is a single area that could have the more significant impact than behavioral health. If we can start to teach people about grit, how to build relationships, especially in the world of AI and social media. We talk often about the epidemic of loneliness that exists, particularly for older adults. We see all the challenges that younger people today have when it comes to building social relationships, social anxiety, depression, self-harm, right? So we know that there's a real role here for that. I love the idea. One thing we talk about at Alma is, will we ever see a world we talk about not just a primary care doctor, but a primary mental health provider, where you have access to that continuous ongoing support that's there for you when you are symptomatic and need it, because we all experience it at some point. We all go through death. We all go through anxiety. We all go through moments of sadness and challenge, but also can be part of those tools you're discussing: gratitude, resilience, grit. I think those are really important parts of building a successful society. Which I think,
for what it's worth, by the way, I have a 9-year-old. I get to watch her elementary school try to teach some of these things. And I think, we're part of what's happening, which I think is positive, is as we've broken down over time some of the stigma related to mental health, we're putting a little bit of the medicine in the water, as it were, and they haven't told us to take it out yet. Political commentary aside, I think that you will find, I think, in a lot of schools now that they work on grit and resilience and understanding what it means to sort of impart those values in children early. It doesn't mean, though, that many of them ultimately benefit from some direct therapy and intervention during sort of particular periods in their life. So Harry, we're going to bump up against time here, but I've loved this conversation. Let me ask you my final question that I have for everybody who comes on the podcast. So, the folks who listen, is sort of the intersection of mental behavioral health, AI, a little bit of brain science, and all sort of subjects related. I'm curious if you have a book, a podcast, a TV show, something you've consumed recently that you think would be really interesting for people who are interested in these areas.
That is a great question. My initial answer was I was going to say Shrinking, the show on Apple TV, which I really liked. Actually, it was just a great show. But there was one element of it that I do think is actually relevant, which it does remind you of just how important the human relationships are in the field that we operate within. And so I think as we are talking about technology and the incredible role of technology and fundamentally reshaping our industry, it is a show that does remind you that the relationships between providers.
Yeah, at the end of the day, like humans interacting with humans, incredibly important. That's the longitudinal Harvard study, right? Like that, the line happiness is basically like there's two conclusions. One is try not to have a chronic disease.
Yeah.
And the other is have lots of important human relationships in your life. And the sort of guarding against loneliness is probably the most important thing you can do for your overall health and happiness. But that requires effort, right? It requires get out and see a friend.
Yeah. But the other one,
more pickleball.
But the one I will add. So I think Shrinking is a great show and incredibly fun to watch and does remind us of the human connection. The one that I'll add, I actually recently reread. It's an older book by a Harvard Business School professor. His first name I'm forgetting, but last name is Christensen, called The Innovator's Prescription.
Yeah, Clayton. Yeah,
Clayton Christian. Thank you. And the reason I was thinking about it as we were speaking today is because I think one of the things we're talking about in this conversation that I really appreciate is the role of business models and systems to drive innovation. Yeah. And I do think that's where we are currently the most broken in behavioral health. The technology is really coming. There's really exciting stuff that's happening. It will come because it's being built and it's being thoughtfully integrated into platforms like Alma. And it's a really exciting part of what the next few years will ultimately bring forward. But the question in my mind, I think the more challenging question is, will we build the systems and business models that can incentivize and bring those technologies to market in ways that really drive the ultimate outcome. And so I think Christensen does a great job in that book of talking about how do you really break down some of these problems. This is in a book, obviously, in a pre-AI era, but the lessons around business model and systems, I think, are very relevant for today.
Yeah, I think those are universal. And he is one of the great, it's funny, most business books I find, you don't need to bother to read, but his stuff is great. That's a wonderful suggestion. Thank you so much for the time today, Harry. This was terrific. Really enjoyed getting to know you, and thanks again.
Thank you for all the work you're doing and hosting this incredible space.